Welcome to the Pomeroy College of Nursing Lab. The following is a demonstration of the skill validation primary IV infusion administration using the MAC system. Wash hands before going to the computer. At the mobile unit computer, click on MAC Train. Sign in with username CRHNurse and password capital S Sorian 123. Select location census 6 Memorial. Select patient. For this video, we will give medications to Benny Fiber. Left click on his name to highlight and then click Select Patient. Check the MAC for medication orders and times of delivery that you will be administering. For this video demonstration, you will be selecting the medication from the PRN section of the active work list. You will be administering 0.9% normal saline, 1,000 milliliters intravenously over 10 hours, now at 12 o'clock. All medications require 3 verbal checks, first upon retrieval, second when preparing, and third when we scan the meds. You are expected to verbalize all 3 checks out loud. Check 1 is retrieval. You will begin this validation in the med room. Left click on the medication. This will highlight it blue. Locate the IV solution in the general supply area of the med room and compare to the MAC. Remember to identify the 6 rights: the right patient, time, medication, dose, route, and documentation. Compare the IV solution bag to the MAC. Benny Fiber at 12 o'clock is receiving 0.9% normal saline, 1,000 milliliters intravenously over 10 hours. You will document after the patient receives his med. Check the expiration date, the integrity of the solution bag, and the clarity of the solution. Check for allergies on the MAC. Once you've identified the expiration date and checked the integrity of the package, you do not need to state this after the first check. You will need to perform necessary calculations to determine the rate of the solution. This will be the right dose. The calculated rate for this infusion is 100 milliliters per hour. Click on the drop-down menu for this medication to compare your calculated rate with the rate indicated on the MAC and confirm they are the same. Gather your supplies from the med room. Select the appropriate IV tubing and 0.9% normal saline flush for the vascular device you are accessing. For this validation, you will need Alaris primary IV tubing and 1 10 milliliter 0.9% normal saline flush for a PICC line. You will also need an IV pole for priming the solution with the Alaris pump, 1 green tubing label, 1 white medication label, Curos caps, Curos tips, and alcohol wipes. You also may want to have a paper cup or bowl so that you have that for your primary tubing when you prime the line. Normal saline flushes can be found in the med room and will require 3 medication checks in the MAC system. This will not be demonstrated for this skill. This is the end of your first check. Check 2, preparation. In a quiet spot. This location will vary depending on your clinical unit. Highlight the medication on the MAC. Check the 0.9% normal saline again using the 6 rights and explain the nursing responsibilities. Benny Fiber at 12 o'clock is receiving 0.9% normal saline, 1,000 milliliters intravenously over 10 hours at a rate of 100 milliliters per hour. You will document after the patient receives his meds. Nursing responsibilities include the reason, which is to provide the patient hydration. Assessments include checking the patient's blood pressure, pulse, and auscultating lung sounds for any crackles in the bases. Check the expiration date and integrity of the primary IV tubing package. Open using the perforated edge and carefully remove from package. Remember that the spike end and the male lure access end are sterile and to maintain surgical asepsis. Turn the roller clamp to its closed position and do not remove the blue plastic covering for the pump mechanism. You may set the tubing down on a clean surface as long as it is above waist level and the caps for the sterile ends are in place. Remove the IV fluid from its package and discard. Invert the IV fluid bag, holding it at the top where there is no fluid, and remove the plug. Now remove the cap from the spike end and spike the bag. Continue to push the spike until it reaches the fluid. You may now hang the IV bag on a pole or hook while holding the tubing in your hand, again not allowing the access end to fall below your waist. Squeeze the drip chamber until it is about 2/3 full. Prepare a cup or bowl on your work surface to collect the prime solution. With your non-dominant hand, hold the male lure end above the bowl without allowing it to touch. With your dominant hand, slowly open the roller clamp and observe as the fluid begins to run through the tubing and displace the air. If there is resistance, you may remove the sterile cap on the male lure end. Priming the tubing slowly minimizes turbulence that can cause air bubbles to form. Once you observe fluid dripping into your bowl, close the roller clamp. If you remove the sterile cap, put on a new sterile Kuros tip. Check your tubing for any air bubbles by placing your hand behind the tubing, starting from the drip chamber and working your way down to the male lure end. Remove any paper that's attached to the tubing. If there is an air bubble, determine which direction the bubble needs to move, either toward the drip chamber or toward the male lure end. Hold the tubing taut and flick the tubing until the bubble moves. Continue this process until the air bubble moves closer to the desired end. If the bubble is moved toward the male lure end, slowly reopen roller clamp and expel the air. Label the green tubing label with your initials, start and discard date and time. Remember that the tubing will expire in 96 hours. Place this label on your tubing. Label the white medication label with the patient's initials and date and time you are hanging the solution. Remember that an open bag of IV fluid will expire in 24 hours unless otherwise indicated. Place this label on the back of the IV fluid bag. Never place a label on the front where it will obstruct important information about the solution. Prepare your normal saline flush. Without opening the package, turn the white sterile cap a quarter turn and gently expel the air from the tip of the flushed syringe. Remember to perform your 3 medication checks for this flush. This is the end of your second check. Check 3, scanning the medication. Check the medication again using the 6 rights. Highlight 0.9% normal saline on the MAC. The medication must be highlighted in order to scan the barcode. Benny Fiber at 12 o'clock is receiving 0.9% normal saline, 1,000 milliliters intravenously over 10 hours at a rate of 100 milliliters per hour. Scan the medication. You will document once the patient takes his meds. You will now see a green check mark to the left of the medication. Once you've completed your third check, look down at the bottom of your screen and click on ID Patient. You are now ready to enter the room. Bring primed IV solution with the Alaris pump, alcohol wipes, and normal saline flush with you to the patient's room with a MAC. This is the end of your third check. After you've entered the room, wash your hands and introduce yourself. Explain why you are there.
Hi, I'm Sherry. I'll be your nurse. I have your IV fluids.
Looking at the patient's name bracelet, ask Benny Fiber to state his name and date of birth. Check to see that the bracelet and MAC state the same name and date of birth. Ask patient to verbalize allergies and look on patient's wrists for a yellow allergy bracelet. Scan the patient's bracelet. The screen will confirm with a green check mark that the scan matches the patient.
I have your normal saline to hydrate you.
Now that the patient knows what he's receiving, complete your assessments. Check his blood pressure and pulse and auscultate his lung sounds for crackles in the bases. Explain the procedure to the patient and provide for privacy. Raise the height of the bed to a working height and put the side rail down on the side you will be working. Wash your hands. Don your clean work gloves. Perform an assessment of the vascular access device by first inspecting and palpating the PICC line dressing, ensuring it is clean, dry, and intact. Inspect and palpate the arm and assess for infiltration or phlebitis. Ask the patient if he has any pain at the access site. Remember to verbalize your findings. Next, remove the normal saline flush from the packaging and hold in your hand. Vigorously wipe the end of the PICC line port you are about to access with an alcohol wipe for 15 seconds and allow to dry. If there is a green Curos cap on the port, remove and discard. The port does not need to be wiped again with alcohol. Be careful not to contaminate the cleansed port by touching it or dropping it back onto the patient's skin. If this does occur, repeat the cleansing process. Access the PICC port with a normal saline flush by pushing and turning into the lure lock. Gently pull back on the syringe knob until blood is seen in the PICC lumen, remembering that only the barrel and knob can be touched. This is called a flash and indicates the vascular access is in the correct place. It is safe to flush the PICC line. Using the pulse pause method, flush the PICC line with 10 milliliters of normal saline. If you meet resistance, check the clamps. Because you are practicing with mannequins, please note to have a bowl next to the mannequin in order to collect the fluid for practice purposes. Leave the syringe in place and reach for the male lure end of the primary tubing. Remove the syringe and vigorously wipe the port for 15 seconds with an alcohol wipe and allow to dry. Without contaminating the port, connect the tubing to the luer lock port using the push and turn method. Remove your gloves and wash your hands. You are now ready to insert the tubing into the pump. Select a module and open the door by lifting the lever. Remove the blue plastic covering from the tubing and discard. Load the tubing into the module by inserting the upper filament into the top notch and the safety clip into the bottom slot. Firmly push on the tubing so that it fits snugly and close the door by pushing the door and pushing down on the lever at the same time. You are now ready to program the pump. Now that the pump is on, follow the prompts for new patient settings. Push the Channel Select white button found under the letter A. Now select Guardrail IV Fluids from the menu and then IVF or IV Fluid Maintenance. Continue to follow prompts to confirm selections. Now program with the rate at which you will be infusing per orders and the VTBI or volume to be infused. The rate is 100 milliliters per hour and the VTBI for this 1,000 milliliter bag will be 950 milliliters. Open the roller clamp and push start. Observe the pump until there is a green light and observe your drip chamber to ensure proper flow. If there is an error, read the prompts on the pump display and follow directions. Because the access device is a PIC, place a green Kuros cap on the top valve. Put the side rails up and lower the bed. Assist your patient into a comfortable position. Chart medication by left-clicking on chart at the bottom of the screen. Now scan the nurse training badge. This is your electronic signature. Let the patient know you are done. Make sure patient has access to the call bell system. Wash your hands and exit the room.